Cardiovascular System Assessment.
Hello everyone, my name is Jonalyn Caintoy from BSN 1A, and for today's video, I'm going to do assessment for cardiovascular system return demonstration. Next to do prior to the procedure is to prepare the necessary materials needed for the assessment to conserve time and energy.
2. Ruler. Tray or small notebook or ball pen. Stethoscope. Sphygmomanometer. Tape measure.
And also, I need to have a proper hand hygiene. It is important to have a proper hand hygiene to protect my patient and for me as well, to avoid infection. Good morning, sir. I am Jonalyn, your student nurse for today. May I know your name? How about your age, sir? Okay, thank you, sir. Sir, today I'll be assessing your cardiovascular system, which means I will check your pulse, neck, arm, leg, and of course, sir, the sound of your heart. I will listen it, and also I will check, I will palpate, or I will inspect and forecast and auscultate your upper extremities, and also I will inspect and palpate your lower extremities. Is this okay for you, sir?
Yes.
Okay, sir. If you don't mind, sir, I will close the window and close the door to provide your privacy, sir, while I'm assessing your cardiovascular system. How you feel now, sir? That's okay, sir. You feel some pain or discomfort or uncomfortable?
No. No.
Okay, sir. Thank you. Sir, may I ask you to turn your head to left side? So now, I will locate the carotid area. Here is the carotid area, the visible palpation. And this one is the jugular pulsation. Okay. It's okay for you, sir, if we will remove your t-shirt?
Yes.
Okay, sir. Thank you. So now, sir, I already removed your t-shirt, then need to provide privacy. So I will cover. Then, so after inspecting, sir, it is the time to get to measure your GVP measurement. Upon noting, the GVP will have a 45 angle to find position. So now, sir, I will expose your chest. It is okay for you, sir?
Yes.
Okay, thank you. So now, first, I need to locate the angle of Louis here. From the depression, I'm going to palpate the manubrium part where is there there is a raise of bone. Then I will place the first ruler cm vertically perpendicular to angle of Lewis. Then so upon looking at the highest position of the jugular vein, I'm going to measure the second ruler horizontal. Then from that I will note that the GVP is 2 centimeter. Sir, can you bend your head? I will palpate the carotid area. Kindly turn your head to left side. Then also in other side. After palpating the carotid pulse, so here the palpate the jugular vein below the jaw. As observed, this area depression because trying to obliterate the flow of the blood of the jugular vein. And now palpate above the clavicle as observed for venous filling this allowing blood. So now we will proceed for the test of abdominojugular reflex. Now I will now going to place this here at the right upper quadrant where the patient abdomen. Then where is the liver located? Looking the sphygmometer at 30 to 40 pressure for 30 seconds. For 40 seconds, looking for jugular vein. For the distension and the rise for pulsation normally after 30 seconds at eye release. So there is easy decompression of jugular vein, that is the negative GVP. So now sir, I will provide privacy, then I will cover your chest for private privacy. Then now sir, I will proceed for auscultation using this bell of my stethoscope. Kindly bend your head up, sir. Hold your breath, sir. Breath normally. Hold your breath, sir. Breath normally. Kindly look at your head, left side, sir. Hold your breath, sir. Breath normally. After auscultating the vessel, now I'm going to assess in precordium, sir. I'm going to expose your chest, sir. At the bottom of the bed, observe the patient chest for the visible pulsation. Kindly bend your head up, sir. So after inspection, I'm going to palpate and locate first the PMI or the apical pulse. So now I'm going to palpate and locate first PMI or the apical pulse. So here, it is after I feel unsure the location of second intercostal. Here, the second intercostal. Then, third intercostal piece. Then, fourth. Then, it is in the fifth intercostal pieces in the clavicular line. So after that, palpate. This is the mitral, the tricuspid area, the Erb's point, the pulmonic, and the aortic. Palpate for left antral. Palpating in this area, the mitral and the tricuspid area. So this one. And this one is the pulmonic area and the aortic area. So now I will palpate the hips of my patient. So my palm will touch here the chest, sir, here, this one. Then I will feel for the bonding, especially if there is heart failure or enlargement, but for you, sir, there is no heart failure or enlargement, so it's good to know. After that, I'm going to percuss of the precordium, non-dominant hand in line at the intercostal spaces. So now, sir, I will percuss aortic, pulmonic, Erb's point, tricuspid area, and the mitral area. So now, sir, I will proceed to auscultation to your precordium. So using this diaphragm of my stethoscope. So the mitral. Can you... Okay, sir, thank you. Mitral. The mitral area. The tricuspid. The Erb's joint. The pulmonic area. The aortic area. So now, sir, I will proceed to the bill of my stethoscope. First, the mitral, the tricuspid area, the ears joint, the pulmonic area, the tricuspid area, the aortic area, then the epigastric,
So, as I auscultate the site, no murmur, no extra sound, and the rate is bradycardia, and the rhythm is regular. It means the result of auscultation is normal.
then I will palpate lightly the epigastric region. Are you still comfortable, sir?
Yes.
Okay, sir, thank you. So now, sir, I will cover your chest for privacy. So now, sir, I will assess your peripheral vascular system. Sir, can you show your hands for me, please? So, so check for temperature and skin color. Rest your left hand, sir. Then now, I will inspect for nails, for capillary refill and tar stain. If you smoke. Do you smoke, sir? Do you
No.
smoke? Okay. Your other hands. Then your lumps, sir. Then your... So, sir, can you show me your palm for inspect and palpate to assess for pillar? Okay, sir. Can you... Okay, sir, can rest, sir. So this one, sir. Okay, sir, thank you. Sir, I will cover your chest for privacy. Then, now, sir, I will transfer to the lower extremities. Is this okay for you, sir?
Yes.
Okay, thank you. So, first, so now, just expose the needed. So, I will assess for distribution, hair distribution, and the color. And also the presence of edema, but no non-edema. And also the characteristic of nails. Good, okay. Then also in the other side, check for hair hair distribution and color. Then percent of edema, no edema. Then check the characteristic of the nails. So it is okay? Okay, sir. Now, sir, I will assess your abdomen for visible pulsation. So, sir, so now, sir, I will expose your chest. It is okay for you?
Yes.
Auscultating and the palpating, sir, will give a hint already to the here the venous pattern here, but there is no visible pulsation. Okay, sir. Then next, I will going to palpate the pulses. So now, sir, I will palpate your pulse. So now, sir, I will palpate your temporal pulse. Also in other. So, and next is the carotid. Can you please see? So other side. Then the apical. And the branchial, sir. How is it? Then the brachial, sir. Also in other hand. And now, sir, is the radial pulse. Then there's no radial delay. Then also in other hand, sir. Also in the other hand, sir. No radial delay. And I will palpate the patient inguinal pulse. And now I will palpate his popliteal pulse here. Also in the other leg. So, then the popliteal pulse. Also in the other side. Now I will palpate for posterior tibialis pulse. Also in the other. Then I will palpate the dorsalis pedis pulse here. Also in the other. So now, sir, I will check for additional test. Kindly move in a sitting position. Okay, sir, I will check your scleral area. If positive edema indicate heart failure. but there's no edema. And so now I will auscultate a note for basal crackles. Sir, I will auscultate your chest. Then can you breathe out all the way? Sige, breathe out all the way, sir. Okay, sir. Sound of murmur and extra sound may indicate aortic regurgitation. So now, sir, I will palpate your lymph nodes bilaterally. First are cervical lymph nodes. Then the clavicular lymph nodes. And can you open, sir? And also the axilla lymph nodes. Palpate for your epitrochlear lymph nodes. And the last is the inguinal lymph nodes. Okay, sir. Can you return in a supine colors position? Skin temperature. Light palpation using dorsum of the hands. So it's normal temperature. Measure forefoot circumference. So 21. And the other forefoot. Also 21. So the forefoot of my patient is both symmetrical. So now, sir, I will measure your ankle circumferences. So it's 18. So also in the other ankle. Here. Also 18. The both ankle of my patient is symmetrical. Now I will measure the calf circumferences. Now I will measure calf circumference. It's 29. So also in the other side, also 29. Okay. So as I measure, the calf circumference of my patient is symmetrical. So now I will measure the mid-thigh. And now I will measure the mid-thigh circumference of my patient. Here. So the measure of his mid-thigh left is 44. Now I will other side. So here, also in the right side, the mid-thigh circumference is 44 centimeter. It means both sides are symmetrical. So calf pain, support patient leg, then dorsiflexes foot while supporting leg. It's pain, sir?
No.
Okay. Also in the other foot, support leg, then dorsiflexes foot while supporting leg. It's pain, sir?
No.
Okay, thank you, sir. I will auscultate using the bell of my stethoscope for auscultation of temporal arteries. So also in the other side of temporal arteries. Okay. So now, sir, I will palpate your abdominal aorta over the epigastric area using the bell of my stethoscope. So, now I will check the blood pressure of my patient. Then place the baby cuff snugly around the limb. Then I will check for palpatory systolic BP of my patient. So, sir, I will allow you to have a rest 1 to 2 minutes. So, after the rest of my patient 1 to 2 minutes, now I will check the systolic and the diastolic pressure. So, sir, your systolic and diastolic blood pressure is 120 over 180.
So before I end this cardiovascular system assessment, so I need to have a proper hand hygiene for safety. So, sir, thank you for your cooperation. And now we are finished for the cardiovascular system assessment. Thank you, sir.